All right, good afternoon. Thank you for your patience in getting started here. We wanted to welcome Dr. Mendoza is joining us this afternoon too, and we wanted to be able to give an update on where we are with COVID-19 and also respond to some news made this morning at the governor's press conference. As the governor had indicated, over the last several days, I have had several conversations with the governor and his team, as have county executives across the state, in working with the state about how we can better respond to COVID-19 and strategies moving forward, particularly as they relate to keeping schools open and our desire to see the kids be able to continue in-person learning. And I am really just delighted that as a result of those conversations, the governor today announced that keeping schools open is a priority for the state, so long as we can keep them safe and keep the prevalence of COVID-19 low within the school buildings. So what was announced this morning was a change in the orange and red zone testing requirements for our school buildings to make this so that the schools could handle the capacity to continue testing children, to make sure kids, teachers, administrators are safe in the schools, and that we can continue to know that the numbers are low even as we start to see an increased prevalence outside of the school buildings community-wide. The new testing requirement for the orange zone is to test 20% of the students and staff per month, and that must show that the prevalence is low within all the school buildings. Red zone testing is going to be at 30% of the students and staff per month. The majority of school districts in Monroe County did previously test 20% of their students over a 2-week period, and I think that showed improved that this was manageable to help keep our schools open, and it's something that we've been advocating for Dr. Mendoza and I for the last several weeks to be able to do that. Keeping our schools open, in our view, is critically important. Schools are safe. The initial testing clearly showed that the prevalence of the disease is low in the schools, and there's also has not really been a significant case as of today of the disease spreading within school buildings. And so we know that schools are safe, and that's where we want our children to be. It's also important for our children, for their education, to receive in-person schooling options, and it will also help the economy as well to allow families and working parents to be able to continue working while they send their children to school. So I think this is a really good development. I want to thank the governor and his team for working with all of us on this strategy, this testing strategy, keeping a few things in mind. First of all is that the schools really have been safe. And we're working with numbers and we're working in facts. And I'm glad to see this development. Also the fact that schools, we really want to keep them open. We want to work together to do that, and also but be able to do it in a way where we can manage the capacity in terms of testing, and also make sure that this is something that we can continue into the future. And so I think the 20 and 30% testing threshold for orange and red is something that our superintendents have indicated that they would be able to do, particularly on a monthly basis, and it's something that I think is manageable and within our capacity. So I think that's good news, and I want to thank again the governor for working with us on that. There's also announced a new cluster zone strategy as part of this, where in addition to looking at positivity rates that we've been talking about, we are also looking at hospitalization rates, fatality rates, case rates, available hospital beds, and available ICU beds, looking at things such as PPE, and really looking at hospitals and their capacity. And I think that that's also a good metric to be looking at. It's something that we include the hospitalization numbers and ICU numbers. It's something we look at a lot, and it's something that we meet with our hospital systems and track weekly what their capacity is, and make sure that we're managing that, and also looking back at the surge capacity plans that we made earlier this year to make sure that we're within capacity and the hospitals can keep up, particularly when we have the surge and the high hospitalization numbers that we have now. As you all are aware as well, is yesterday we did announce a new community testing initiative. Again, this was an announced targeted public asymptomatic testing. And I say asymptomatic because if you are symptomatic and have symptoms of COVID-19, you should be working with your primary care physician and a medical professional to get tested. But we have the public asymptomatic testing. We were targeting it initially in orange zone communities, and those The pre-registration will be required at each location. Monroe County is supplying test kits and PPE for all of the testing locations. The tests are conducted right on site. Individuals will not be allowed to leave with a test. This isn't a test that you pick up and take home. You're tested on site, and then you'll be followed up with if you test positive. We're going to continue to announce additional dates, times, and locations as they become available and if it changes. But initially, the town of Aronicoit is hosting the testing site there at the Department of Public Works building on East Ridge Road from 5 to 8 on Tuesday, December 1st, starting tomorrow, and Wednesday the 2nd. Like I said, pre-registration is required and is available on the website. The City of Rochester will be starting its testing this Saturday from 11 to 2 at East High School. The town of Brighton will be at Temple Birth Kodesh on Elmwood Avenue on Tuesdays and Thursdays starting next week from 2 to 4. And so the first day for there is December 8th. And then the town of Gates will be at the Gates Memorial Park beginning this Wednesday from 4 to 7. All the details that we have on each of those testing locations is available on our website, and so is the registration information as well. As more information becomes available and additional dates or locations are scheduled, we'll make those again available on our website as they come as we have them. I want to thank again New York State for helping us with the community testing initiative and all of our community partners. None of that would be possible if it weren't for the collaboration between New York State Department of Health, the governor's office, our municipal partners in the towns, the town supervisors, the mayor of the city of Rochester and her team, and all of our partners who are all collaborating. No one individual or one group could make these testing sites happen and available in a vacuum on their own. This was a true community effort to get this and to make the rapid testing available community-wide, particularly as it relates to the orange zones and trying to get in there and get more and more testing to be available as soon as possible. So with that, I'll turn it over to Dr. Mendoza, who could talk about the numbers.
Thank you, County Executive Bello, and thank you again to all of our partners in the media for joining us on such short notice. Obviously, there's a lot happening. Things are changing rapidly. This past weekend saw record-breaking increases in the number of new cases that we reported both on Saturday and on Sunday. And today, we are going to be reporting 541 additional cases. In addition, we will be reporting 11 additional deaths. Those are 11 members of our community who we have lost to COVID-19. I will say that a number of those deaths occurred many weeks ago. These are data that we are now just becoming aware of, partly due to the holidays and reporting delays and so forth. But make no mistake, this disease is real. 11 people in our families, in our communities, in our neighborhoods have lost their loved ones, have succumbed to this illness. And so this is very, very real. Our case numbers, our hospitalizations, our ICU statistics are all increasing higher than they ever have been in the past. And so what I would say simply is this: we're at a tipping point again in this crisis, and we need to find a way for all of the good things that we are trying to implement at the community level, at the regional level, at the state level. The fact of the matter is that the future of all of this rests in our own homes, in how we behave, and how we take seriously the precautions that we've been talking about now for months. The next few weeks and months will test the mettle of Monroe County, and we have to find a way to work together. We have to find a way to take this very seriously. The numbers that we're reporting now are zero reflection on the Thanksgiving holiday. We are going to see the results of Thanksgiving holiday in the coming days, and my anticipation and my advice to my team is to plan for a large increase in numbers, unfortunately. And I'd love to be wrong, but every indication is that the numbers are very likely to increase in the coming days and weeks. So with that, again, a simple plea to the community that we need to take this seriously. The unifying theme in all of our cases has been the absence of taking precautions, whether it's wearing your mask, keeping your distance, being thoughtful about your gatherings. That is the unifying feature of all of the new cases. And quite frankly, we can take this into our own hands if we took this seriously and took heed of these precautions. So with that, I'll hand it back over to Steve and Megan and the County Executive. You're muted.
Tools are working. and why the numbers, okay, I think I might have been on mute. Let's talk about schools for a moment and why they're working and what we're seeing in the community. The reason why schools are safe is because they're following the guidelines. And as Dr. Mendoza said, one thing that all of our positive cases, or most of our positive cases that are found through contact tracing have a common theme is that the protocols were not being followed in terms of masking, physical distancing, things like that, large gatherings. And so what's happening in the schools? The schools are following the guidelines. The children's desks are 6 feet apart. The children are wearing masks. The teachers, the administrators are wearing masks. They're keeping a distance. They're hand washing. They're using good sanitation. They're following each of the protocols that the state has laid out, and that has kept the children safe. And I think that that's good proof that the protocols work, the advice works, and if we all follow it, it'll work too. It worked earlier this year when we were back in March and April and May, and we faced a surge back then. We were able to manage that because we're all participating, working together, understanding how we save our hospital system and keep the numbers down. This feels a lot different now because we see a much greater prevalence. We know a lot more about the disease, but we also see a greater prevalence. And we're also seeing that, before earlier this year, you may not have known somebody or that had it or contracted it. Now it seems to be everybody seems to know somebody who has a story to tell. That, again, should amplify the urgency that we have to follow the guidelines, follow the rules, and do what's right, not just because we're asking you to or the government's telling you to do the right, because it's the right thing to do, and because it'll protect your family, it'll protect the community, and it'll help our hospital systems and all those great employees there who are working around the clock to keep us safe. We have to manage the hospital capacity. It is critically important that we have enough capacity to handle all the medical issues that come up in our community, and it's going to take all of us participating and working together to keep our numbers down. So with that, we're happy to take some questions that you all might have.
All right. First up is Tanner Drupaville from 13 WAM.
Hi, good afternoon. I wanted to ask more about the rapid testing. So one thing that we know in Ronnequoit that demand was so high, they filled up in less than 2 hours, I guess. Can you talk more about the supply that will be coming in to help keep this will this become like a reoccurring event in these towns? Because I know the demand is high, and I know that it also depends on supply, probably from the state as well.
Yeah, it does, and that's why pre-registration is going to be important here as well, as to be able to manage the demand and the supply. Right now, we had dedicated around 6,000 initial tests to this effort, but we're looking and hoping to expand that and continue to do it at least through the end of this year. So New York State has been a great partner in sending additional kits, and they've indicated that they'll continue to do so. So as long as the supply of kits is still available, we are hoping to be able to continue this effort through the end of the year.
Do you have a follow-up, Tanner?
I do, on a different topic now. This one might be more geared for Dr. Mendoza, but I know it's been about a month. We've been hearing a lot about, at least at that time, a lot about Halloween parties. I guess, are all these new cases, is it all stemming from that still? Or I guess, what is the contact tracing team, I guess, what are the patterns and trends you're seeing with the contact tracing team and then what you're finding there?
Yep. So we saw the surge in Halloween cases probably end around mid-November. So we're no longer seeing much resulting directly from Halloween. What we are continuing to see is just more of the same gatherings in private settings, generally in people's homes, generally involving, reasonable sized gatherings, not terribly large, but these are gatherings that are happening in people's homes. I think there are a number of misconceptions that people need to clarify around this. First of all, it's the thought that just because you have a negative test means that you don't have COVID. That's not true. The reality is you could have a negative test today, but if you had a high-risk exposure yesterday and an infection today, the test today may not be positive. And so I think there are a number of factors that are contributing to all of this spread. And I think people are trying to do the right thing. People are using these tests as a way of trying to understand. But the reality is that none of these tests, when they come back negative, should be viewed as a certainty. The last thing we need, and we know this because a number of people in our tracing have said, well, I took a test yesterday and it was negative, so I thought it was safe. And the reality is, we've seen a number of cases and clusters in households result from that very misconception. So it is more of the same, unfortunately. And, we will anticipate starting to see some of the numbers resulting from the Thanksgiving holiday, perhaps later, even midweek this week, certainly over the weekend this weekend. So.
Okay, thank you, Tanner. Next up is Randy Gorman from WXXI.
Yes. Hi, guys. Thanks for doing this afternoon. Either Adam or Dr. Mendoza, whoever's better at talking about the deaths, that's kind of a startling number, 11 more deaths. Dr. Mendoza, you said that was over a period of weeks, but just by the way this disease progresses, should we expect to see more deaths on a daily basis, which we really haven't had that rapid of an increase in recent weeks?
Unfortunately, yes. The reality is that this is a pattern that has played out across our country. Spikes in cases result in spikes in hospitalizations. Now, the delay has somewhat to do with the ages of people who are infected initially. And in our case, as many of the cases around the country, the initial sort of wave was in that 20-year-old to 25-year-old group. But now we're seeing the older relatives and older loved ones of those young adults now becoming infected. And those are the people who are largely in the hospital. The age range of people in the hospital is spanning all ages. I'll say that now. And then it's not a surprise when you see that the deaths follow. Generally within 2 to 3 weeks of that increase in hospitalizations. And if you look at our hospitalization numbers now, it bodes for a very sobering December. So I think this is something that we unfortunately need to be mindful of, because truly we can shift this tide if we take our precautions. None of this has to be a foregone conclusion, but we do need to take this seriously, and we need to start right now.
Thank you.
Do you have a follow-up, Randy?
I'm all set. Thank you.
Okay, thank you. Next is Jennifer Lukey from WHEC.
Good afternoon. Dr. Mendoza, I'm wondering what you are seeing as far as nursing home spread and deaths. We have taken a number of calls from concerned family members who are getting notifications that it's spreading quickly within some of our nursing homes. I know that's a state health department focus, but I'm assuming you're in touch with these nursing homes as well.
Yeah, I don't have the latest numbers in front of me, but we have been in touch with a number of the nursing homes from the standpoint of staff. And this is a reality that we lived through earlier in the spring. We know the importance of PPE. We know that even with the best of precautions, sometimes people make mistakes in break rooms and inside and outside of work. But this is something that we're following very, very closely. I've asked our long-term care task force to reconvene now. They've been meeting weekly now for about a month, and we're going to be increasing our frequency of meetings in the near future. So this is an area of intense scrutiny, but my focus has been around the staff. And the more the risk of contracting the infection is in the community, the higher the likelihood that staff members will fall victim to this infection. And so the best thing that we can do to help our nursing homes is to keep the community rate down so that there's a lower probability for those who are working a very difficult position of working in our nursing homes, that we do everything we can to decrease their chance of contracting this infection inadvertently.
And County Executive Bello, a month or so ago, the grant program that you announced closed. I'm wondering what the update is as far as when you will have any determination on the businesses that are getting that help, and if at this point you will reconsider who you're choosing based on the orange zone closures.
You're correct that the application period closed. I don't have the figures on me, but we are in the process of still going through. Is around, I think, 2,000 applications that were submitted in various stages of being done. We had to work with a lot of companies and businesses to finish their applications with them. There have been a number that have been approved, and some funds have already been distributed. I can get you that number though after this, where we are.
Do you anticipate upping the amount in that fund for businesses, particularly who are shut down?
Unfortunately, we're limited in the amount of CARES Act dollars that we received, and so we're not able to expand the program at this time. But as we get closer to the end of the year, if there's opportunities to do that, we certainly can. But again, this is also why, I want to thank our federal partners, first of all, for their help and partnership in providing these funds to be able to allow us to respond to the community in these ways. But this is also why we need greater partnership going into the future with the federal government. The CARES Act dollars needs to be spent by the counties before the end of the year under the current guidelines. So those dollars have to be out within the next month. But we're clearly not out of the woods from COVID-19 yet, particularly as we're entering the orange zones. There's an awful lot of small businesses, bars, restaurants, salons, barbershops, gyms, and the like that are losing business. They're closed. They're going to be going, potentially going out of business. And we really need help from our federal partners into the new year to be able to help support these businesses, be able to manage this, because this is going to have a long-term economic consequence. So we're working right now with the funding that we have to be able to get that out the door and help as many small businesses as we can. But I am concerned this is going to have a long-term economic impact on our community if we don't get additional support from Washington.
Great. Thanks, Jennifer. Next up is Patty Singer from the Minority Reporter.
Hi. I'm curious, there were some numbers that the Center for Community Health put out about cases and increases. From October to November, the number of cases per 100,000 among whites increased 93%, but among blacks and Latinos, the cases increased, but at much lower rates. Can you say what is happening in different communities that we're seeing now? White community, 93% increase from October to November, and it appears to be contained or trying to be contained in minority communities.
Well, before we make any conclusions, let's remember that we're only diagnosing what we're testing. And so I think we have to make sure that we're increasing capacity for testing in the city. Because if the lower numbers in the city are a result of not testing enough, then that conclusion is premature. That being said, it's been a pretty consistent trend in looking at the number of cases that we have found through contact tracing and subsequent testing, that the vast majority of additional cases have been happening in the suburb, more so than in earlier months in the pandemic. And so, the conclusion that we're drawing is that there are a lot of gatherings that are happening in the suburbs. I imagine that these gatherings are happening in the city, but for whatever reason, the transmission in the city is not nearly what it looks like it has been in the suburban zip code. So I think we need to pay attention to gatherings no matter where we are. I think we need to make sure we're taking our precautions no matter where we are. And I would probably want to withhold, judgment as to, the reason for why it looks like there might be a lower rate in the city right now, because I'm not sure I'm prepared to make that statement yet.
So following up on that though, with testing with the site at East High School, what else is going to be done to make sure that you're sampling a large enough size so that the numbers are true, in a sense, on scientific word?
So my understanding is that we're going to be testing at 4 different sites in the city. Now, we have to make sure that we're testing in a random sample of city residents. So if we're simply testing among students, that's not going to be a representative sample of the rest of the adult population in the city or anywhere. So we've got to make sure that any testing program that we undertake is honest, is taking as random a sample as possible so that we gather accurate data and draw valid conclusions about the prevalence of COVID in the city or in any community. But I do think that we've got to increase our testing capacity in the city so that we can answer those very questions that you've posed, Patty.
Thank you.
Thank you, Patty. Do we have anyone on from Spectrum? Okay, we'll come back to them. WROC? Okay.
That was it? Okay. Great. Thank you, everybody, for joining us today. I just want to close with just a couple quick things. First, I want to thank the schools, all the faculty, the staff, the teachers, the administrators for all of their work, particularly those in the orange zones that had in-person learning that worked so hard over the weekend and today to do testing of their students and staff. I just want to thank you so much for your work in doing this and partnering together to make sure that we're providing every opportunity for our children that we can. I also want to thank the parents for working with the school districts. I know this isn't easy. I'm a parent myself, and so I know, and can see firsthand and know, how challenging this can be, particularly when the guidance changes. And I know that's frustrating, but what we know changes, right? And the numbers change. So we all have to be flexible, just like we've been right from the beginning, to be flexible, but to work with our schools, our parents, our administrators. So I want to thank families. I want to thank you for being flexible. And just remind everybody, the future is all in our hands. What the numbers look like 2 weeks from now, 3 weeks from now, 4 weeks from now is entirely 100% relatable to what we do today. And we learned earlier this year, if you go back to March and April, what did we do to keep the numbers low? What did we do to keep them below 100 new cases a day, right? It's like we stayed inside our homes. We only went out when we absolutely needed to for essential functions. We went to the grocery store, only one person from a household at a time. We took a lot of steps to reduce capacity, to reduce interaction that was unmasked, and to really slow the spread. We have to be cognizant of that now. We have to go back to what we were doing in March and April because it worked. And if we do that as a community and work together, I have all the faith and confidence in the world that we are going to get through this. And one way or another, we will. We're going to do it because we're working together, and we're going to get our numbers back down. But we have to take steps. If we don't take action now, take steps now to reduce the spread, then the numbers will not change. They will continue to go up. So we need to work together to keep our numbers down, to flatten the curve, and make sure that we do not overwhelm the hospital system and that we don't lose any more lives in our community to this terrible disease. So with that, thank you so much, and we'll talk to you later this week.